Happy Friday to all of you. I have breaking news to share with you today. Millions of Americans, especially retirees and seniors, are facing a dramatic rise in Medicare costs. Top experts are blaming the Inflation Reduction Act that President Biden and Democrats had signed into law. This is as Medicare Part D prescription premiums are expected to jump by as much as 50% next year. My dear friends, please make sure that you watch until the end of this video. Also, in a video later today, I will be announcing several winners for the Walmart gift card giveaway. If you would like to enter these weekly giveaway, friends, all you have to do is click and like several of my videos and then comment below the keyword of each video that you watch. The more videos that you comment on, friends, the greater your chances of winning these giveaways.
I'm coming to recognize myself for 5 minutes. I'd like to insert a letter into the record from the Consumer Bankers Association commenting on today's hearing. And Director Chopra, your recent Fair Credit Reporting Act proposal on data brokers and consumer data, it doesn't include a fraud exemption when an entity is using data to help verify a customer's identity. The treatment of credit heater data described in the outline would prohibit financial institutions from using it for the essential anti-fraud purposes for what it's used for today, I guess. As you know, identity verification and consideration for credit worthiness are two distinct actions with their own legal frameworks, KYC laws, and the FCRA. Have you consulted with prudential regulators and FinCEN to understand how capturing identity verification activities under the FCRA may impede compliance with the Know Your Customer requirements if in fact the data is considered a consumer report?
Yeah, so just to be clear, we have not made put forth a proposed rule. One of the places that we know there is a huge desire for fraudsters to take control over is really that identity-related data. So we're trying to think of all the ways in which we can protect it, but not undermine, really what banks and lenders are legitimately trying to do for financial services. So to answer your question, yes, certainly we have discussions with the Treasury, FinCEN, others on a wide range of issues. And I can assure you that your message here is loud. I hear it loud and clear. We don't want to do anything that undermines some of the legitimate financial company work. And I think it also goes back to something Mr. Foster said about identity verification. I really think all of us need to work on what is the future of identity verification, because it can open up a lot of questions for harms in the country if we don't have a robust one.
Very good. Let me shift here. A small pediatrician office in Sheboygan, Wisconsin, has estimated that the CFPB's proposal to remove medical debt from credit reports will lead to a revenue decrease by 11% or $11,000. I worry that further reducing the information that lenders have on borrowers, it's just going to result in higher costs and higher rates for all. Is there any way that CFPB has studied this or, tried to figure out what the impact would be on individual?
Several Democrats facing tough re-election battles next year are dealing with criticism for supporting President Biden's Inflation Reduction Act. This legislation was promoted as a way to reduce health care costs for seniors, especially regarding prescriptions. However, experts now argue that the Inflation Reduction Act is causing a significant increase in Medicare Part D prescription premiums. It is up 57% in some states. Democrats in key states targeted by the Republicans for the 2024 elections, such as Nevada, Pennsylvania, Montana, Ohio, and Wisconsin, had previously praised the Inflation Reduction Act. They claimed it would lower drug prices for seniors and reduce health care costs for families. Senators like Bob Casey, John Tester, Sherrod Brown, and Tammy Baldwin all expressed their support for the Inflation Reduction Act, emphasizing its positive impacts on lowering prescription prices. But But despite these claims, a study by HealthView Services revealed that the legislation is driving up Medicare Part D prescription costs significantly in certain states. According to the president of HealthView Services, the bill's $2,000 cap on out-of-pocket spending for Medicare recipients may benefit those with large medical bills, but could lead to higher premiums for seniors. Reports from Kaiser Family Foundation also raised concerns, stating that the IRA's premium stabilization provision did not effectively control individual plan premiums, resulting in a projected 21% increase in average prescription plan premiums for 2024 compared to 2023. According to The Hill, Democratic presidential candidate Representative Dean Phillips is endorsing Medicare for All legislation. It is a move likely meant to appeal to progressives. In his statement, the Minnesota lawmaker claimed medical debt accounts for 67% of U.S. bankruptcies. Phillips acknowledged some people may want to keep their private insurance plans, but he argued that once they see the cost savings and the increased benefits, he is confident they will have a change of heart. The legislation was originally proposed by Democratic Representatives Pramila Jayapal and Debbie Dingell, along with Senator Bernie Sanders. Under Phillips' proposed plan, there would be no co-payments, deductibles, or cost sharing, and the country would transition to the system by the end of his first term. The Minnesota Democrat claimed the country is already paying enough for each American to have health care, but the exact funding strategy and mechanism for funding will need to be figured out by Congress. Phillips officially announced he was challenging President Biden in the 2024 presidential race in October, after previously signaling he would not do so. He has repeatedly called for a competitive primary instead of Biden running unopposed for the nomination. Civilian federal employees are officially set to receive a sizable pay raise in 2024 after President Biden signed an executive order implementing the increases. As expected, most general schedule employees will receive an average of 5.2% boost to their pay, which will take effect in the first pay period in January. Biden made plans for the 5.2% raise official in August, after first including it in the fiscal 2024 budget proposal in March. It is the largest year-over-year raise for federal employees in more than 4 decades, and follows a 4.6% raise that kicked in for 2023. Biden signing off the executive order was the final step of the process to make the federal pay raise official, although Congress has, in some past years, occasionally legislated its own separate federal pay raise proposal. It was not included in any legislation this year ahead of the December 31st deadline for Biden to sign the executive order. Importantly, the 5.2% figure for the 2024 federal pay raise is an average. Depending on where federal employees are located, the actual raise they'll see in the new year will be slightly above or below that. Well, my magnificent and most marvelous friends, that is the end of my daily stimulus update video for today. Thank you, dear friends, for being part of this community. I will be announcing several winners for the Walmart gift card giveaway in a video later today. So please make sure that you do stay tuned. Thank you, friends, and have a wonderful and very blessed day.